So the next topic that we are going to talk about is intestinal TB. So intestinal TB is the TB of the intestines, tuberculosis of the intestines, and then this can be duodenal TB, jejunal TB, or ileocecal tuberculosis. Ileocecal tuberculosis is the most common intestinal tuberculosis. So what is the pathophysiology? How does the intestines get affected with the tubercle bacilli? So there are three pathogenesis. Three of them. So the first one is the tubercle bacilli. If it is ingested through the infected milk or sputum of either the infected person or the infected milk, that is of the cow. So if the human ingests it without pasteurizing the milk, so in that cases it will reach directly the intestinal tract, and then it affects the lymphoid tissue and the submucosa of the intestines. So that is one thing, that is if it is ingested. So the second mode of spread is hematogenous spread. So hematogenous spread, it can occur from, if the tuberculous foci it is there in the lungs, it can travel through blood and can reach the intestine. So that is hematogenous spread. And then the next one is direct spread from adjacent structures. So if the adjacent structures, if they are having tuberculous foci, then it can also affect the intestines. So these are the three pathways through which the intestines can be affected with tuberculosis. So we know the causative organism. Causative organism is Mycobacterium tuberculosis, and in animals it is the bovi. So bovi is the species that affects the animals. So the diagnosis is through CT scan. You have to do CT abdomen, and then you can also do a barium study. And the treatment is the same old basic treatment, that is the anti-tuberculous therapy. So the ATT is the treatment of choice, and then if the tuberculosis it has affected and the intestines are they are not functioning to their to an extent, then you can also choose surgery as an option. So this is intestinal tuberculosis.